Okay, read the chart. Have to, need to, and must. These are modals. We're talking about modals like may, might, must, should, shall, will, would, could, have not, and cannot. But we're just going to talk about have to, need to, and must, which we use to state a requirement. May and might we use to say that something is possible, and should to make a suggestion or a recommendation. So this is the form. We need the subject, then the modal, then the made verb. So for the subject, we can use the pronouns I, you, he, she, it, we, they, and then comes the modal. So it can be any of these. I need to, I should, I must. He has to, she has to, it has to, he needs to. But if you're saying should, you still just say he should, right? And then the verb, he should take. See here with she, have changes to has. She has to chew 4 tablets. So it's subject, modal, and verb. I should take 3 tablets. That's a suggestion or a recommendation. We need to get lots of rest. Need to is a requirement. They must swallow this medication. It's a requirement. You have to. Okay, so this one we're just looking at need to. And they show you here when it's he, she, and it, need changes to needs. And again, we have the subject, the modal, and the verb. So in the examples, you can see first, I, you, we, they, she, he. First is the subject. Then you have the modal and the verb. I need to take 3 tablets. You need to drink lots of water. We need to get lots of rest. They need to swallow this medication with water. So when we get to he, she, it, we need to change. So she needs to chew 4 tablets. He needs to get his medicine. Okay, read the symptom and advice word banks. So first we have the symptom word bank. Symptoms are things that you feel when you don't feel well. When you're sick, you may have a runny nose. A runny nose is a symptom. You may sneeze. Sneezing is a symptom. You may cough. Coughing is a symptom. You may have chills or a fever or a sore throat or a headache. So all of these are symptoms. So if you have these symptoms, you may take some advice. Somebody may say to you, stay in bed, take aspirin, get lots of rest, use a heating pad, drink hot tea, or call the doctor. They might say, you should stay in bed. He should take aspirin. We should get lots of rest. Okay, so this word bank is advice when you have symptoms. So we're going to ask you to match the symptoms and the advice.